Good evening, everyone. Good evening here on the East Coast. Good afternoon if you're on the West Coast. My name is Brad Woodhouse. I'm the executive director of Protect Our Care, and I'm so happy that so many of you have joined us tonight. And I'm so happy with this awesome panel. Look, if you have joined us tonight, you know what the topic is. We are talking about the importance of healthcare. We're talking about healthcare being on the ballot in this election. We're talking about less than a month to the most important election in our lifetimes. I know you hear that every single presidential cycle, but this is absolutely the most important election of our lifetime. And one of the top issues that we've seen over and over and over and over again over the last decade and a half. I go back with Speaker Pelosi. She probably doesn't remember this, but I go back to 2005, 2006, the 6 for 06 when we were trying to get prescription drugs done, and then on all the way through to passing the ACA, defending the ACA, stopping repeal, passing the Inflation Reduction Act, lowering prescription drug prices for seniors, and trying to even do more. Healthcare is on the ballot, and that is what we are going to talk about tonight. Now, as they say, a picture, or in this case, a video, is worth 1,000 words. So we have something that I will call from Nancy Pelosi Productions. And I want to start with that, and then I'll come back on screen after that video, and I will introduce our special guest, and I'll talk a little bit about the rest of our panel. So with that, let's cue the video.
Going to see. Oh, weird.
People. And a woman's right to choose is a very important part of that. When, if, and how to proceed to have a family. So as we go forward in this campaign, what we're doing is making sure people are aware of that. As you may recall, in 2018, when we won, people said, "Oh, weren't you lucky that healthcare emerged as such an important issue in the campaign?" I said, "No, we weren't lucky. We made our own luck." What is at risk? The Affordable Care Act. The former president already said that was his target. And that is important. People have to know when we talk about democracy being at stake, it's your freedom to have health care, to have, if you have pre-existing conditions, or not to have limits on the care that you can receive. So that list goes on and on about a woman's health in terms of her reproductive freedom. So let's not talk about them. Let's talk about what comes next. Let's give people hope.
It's about showing up. When you show up at work, you want your employer, or your employee to know that you are fully present. We all care about our children all the time, or our elderly parent, or whatever it is. We all care about that, yes. But you have to have enough confidence in the safety and security of the healthcare that that person is getting to be able to show up, and your person knows you are there.
ACA is here to stay, even though what's his name says ACA sucks. We say, no, it cures. It cures, and we have the evidence and the personal stories to prove that. Thank you, thank you, thank you, because without you, we wouldn't have passed it, we wouldn't have saved it, and we have to do it again.
Wow, I don't think that I can actually add a lot to that. And thank you, Speaker Pelosi, for that great production. I do want to just reflect a little bit on how important this issue is. And what we're really talking about here is how we want you as activists, and we want you as people, and we want you as organizational leaders, and you as voters to go out and talk about this issue in the last 33, 34 days of this election. But just a teeny bit of history. Donald Trump ran on repealing the Affordable Care Act. His first act was an executive order to sabotage the Affordable Care Act. His first legislative initiative was to repeal the Affordable Care Act. And then fast forward to last night, J.D. Vance, the vice presidential candidate, the biggest liar in the history of vice presidential candidates, stood on stage and said, Donald Trump saved the Affordable Care Act.
Okay.
What a, so this is where we've come. We've come from them telegraphing that they want to repeal the Affordable Care Act, trying to repeal the Affordable Care Act, to now we know, as a result of Project 2025, we know Donald Trump has said in this election cycle that he wants to terminate the Affordable Care Act. We know J.D. Vance wants to repeal the Affordable Care Act. We know as a party they want to repeal the Inflation Reduction Act. Full stop, the whole thing, and including all the reductions in prescription drug costs. But somebody got in their ear and said, well, you got to lie about it at least until the election. You got to lie about it until the election. So J.D. Vance got on stage last night and said, Donald Trump saved the Affordable Care Act. No fucking no. I'll tell you who saved the Affordable Care Act. Nancy Pelosi saved the Affordable Care Act. Leslie Dock, the founder of Protect Our Care, who you'll hear from in a little bit, saved the Affordable Care Act. Ann Shout saved the Affordable Care Act. Elena Hung saved the Affordable Care Act. Adam Boyer saved the Affordable Care Act. Reggie Hubbard saved the Affordable Care Act. The American people saved the Affordable Care Act. Democrats saved the Affordable Care Act. And you know what? John McCain, Lisa Murkowski, and Susan Collins, 3 people of conscience on that vote, saved the Affordable Care Act. Donald Trump, every single day after the failure of repealing the Affordable Care Act, his administration, his secretaries of Health and Human Services, his people that ran Medicare and Medicaid, they spent every single day trying to sabotage the Affordable Care Act. When they couldn't repeal it, they tried to kill it. And they tried to kill it with 1,000 cuts, and we stopped them. Nancy Pelosi, we refer to her as Speaker ACA, but it's so much more than that. Nancy Pelosi passed the ACA. Nancy Pelosi saved the ACA. She didn't stop there. She didn't stop. That's a great accomplishment. She didn't stop there. She said, you know what? We got to do something about prescription drug prices. And you know what? She ran on that in 2018, and we took the House, and she passed legislation. But, you know, of course, the McConnell graveyard, Donald Trump, they weren't going to do anything. So then fast forward, we take the House, we take the Senate, Joe Biden's in the White House, and Nancy Pelosi's vision for lowering prescription drug prices came to fruition. Republicans stopped it from affecting everyone. You know, they used parliamentary maneuver to say that, well, only people on Medicare can get lower prescription drug prices. We're running right now to protect the ACA, to protect the IRA, and to bring prescription drug prices and lower coverage and expanded coverage to every single American. And with that, I want to turn it over to Speaker ACA, Speaker Emerita, my hero, Pelosi.
Thank you very much, Brad. Brad, you've saved and helped us to pass the Affordable Care Act. You know that, but I agree. Everyone you named there and so many more. The people listening here, you're our VIPs, our very important people. We could, whatever inside maneuvering we were able to do, would not have achieved the success that was possible, and we want more, without your outside mobilization. It is the outside mobilization makes it all happen. So thank you. Just to talk about Protect Our Care for a moment, if I may, because we have a lot to hear from our special guests, from their experience as well. Here's the thing. Sadly, in November 2016, Hillary Clinton did not win the White House. We thought the Affordable Care Act was going to be safe and sound and growing under her administration. Instead, what's his name did? That very day, the next day, as soon as we knew, some of us got together, some are on this call, and we said we are going to launch our effort to protect our care. We determined that it would be on Martin Luther King weekend, that we would have events all over the country on that weekend about care. Dr. King had said, of all of the inequalities, the inequality in terms of healthcare is the most inhuman because people could die. So rallying the troops around his vision, as well as the necessity to save the Affordable Care Act, we went to work. I know in San Francisco that day, and Martin Luther King weekend, we had 3,000 people who turned out, but that was replicated all over the country. Protect our care. Leslie and Brad and all of you making that so possible. And then again, we wanted to not only to protect it, but to grow it. As Leslie then said, Brad said, the 3 Republican senators who stuck with us enabled us to protect our care. But in between, you should know this. There were 10,000 events that Protect Our Care initiated across the country. 10,000 events where people came together and talked about what it meant, the Affordable Care Act meant to them. They didn't talk about provisions in the bill. They talked about their personal experience, their baby born with pre-existing conditions. The list goes on and on as to what the Protect Our Care of the Affordable Care, well, Patient Protection and Affordable Care Act did. Those 10,000 events under the auspices of Protect Our Care saved this legislation for our country. And now under Joe Biden, it expanded the lowering the threshold to be eligible for a subsidy, made many more people eligible, but also made it all more affordable. We ran, remember, Brad, when we were doing this in 2006, 6 we had 6 things we said we were going to do: raise the minimum wage. 6 things we were going to do. One of them was to enable the secretary to negotiate for lower prescription drug prices. We couldn't get it done. We passed it in the House, but 60 votes in the Senate, that's a challenge. And until we put it in the IRA as a reconciliation bill, but it had its constraints, as Brad said. So we have more work to do for more drugs, more prescription drugs. So here's the challenge. What's his name? Former president. He goes to the fossil fuel industry and says, give me $1 billion for my campaign and I'll get rid of the IRA. The IRA put $70 billion to protect our planet, which is a health issue, clean air, clean water, the list goes on, but also had the lowering of prescription drug prices in it. This was remarkable that we were able to do it. And we did it without one Republican vote. So as we go forward under the leadership of Kamala Harris and Tim Walz in our Democratic House and Senate, which we must win in this election, we want to expand the opportunity further with lowering the the threshold and expanding the subsidies, but also expanding the number of prescription drugs that are already on the list, but then to have them be acted upon for the American people. If you go to people's kitchen table, democracy is on the kitchen table. Democracy is there for freedom for a woman to choose, a family to choose the size, timing of their family, and that's an economic issue too. Freedom of people to choose who they love, who they live with, and the rest of that, and that's a kitchen table issue too. But the list goes on: the cost of healthcare, the cost of prescription drugs, the rest of that, but the minimum wage, pension, and all that, all the things that are part of the Democratic agenda, but are not part of the Republican agenda. Project 2025, do away with a woman's right to choose, so disrespectful of women. How about eliminating the Department of Education, because they teach critical thinking in those schools. We have to do away with that. And who does that hurt? Children in economically disadvantaged areas. Children on using Head Start to get a Head Start, all that. So this election, as Brad said, we always say this is the most important election of our time. Well, this one is. We must win. It's an honor for me to be on here with Brad and Leslie and Reggie, darling. I'm so happy to see you back. I've been praying for your comfort. I knew you would be well. I want you to be comfortable, and now you're back. I'm so happy to see you. And Anne, wonderful to see you, and thank you for all the work that you have done. Elena, when she talks about Shiomura and the pre-existing conditions and the cost of all of that, I don't know that anything could be more persuasive than that. But just remember this. What's his name? Former president. He said, Obamacare sucks. Forgive my crudeness, I'm just quoting a president of the United States. Obamacare sucks. No, it doesn't suck, it cures. It cures, and we're going to do everything possible to make it cure many more people. And that's what we have to do in this election. So this election can be a healthcare is becoming a healthcare election as well. So thank you all for what you are doing, what you will do, so that we can celebrate 5 weeks from today, which would be the day after the election, having no regrets that we could have done just one more thing to win the election. Thank you all so much. Onward to victory for the people, for the children. We're a healthier America. Thank you, Brad. Thank you, Leslie. Thank you, Ann. Thank you, Reggie. Thank you, Elena. Thank you all so much. Outside mobilization, it's everything. We don't agonize over it. We organize over it. Thank you so much. Bye-bye.
Speaker Pelosi, I cannot thank you enough. I don't think, first of all, if you have not read The Art of Power, if you've not read Nancy Pelosi's treatise on her time as a leader and you just think about the brief period of time that we have presidents, 4 years, 8 years. Nancy Pelosi has been a leader in this country at the very top levels, for 25 years. She has led. She's led on 9/11. She's led on healthcare. She has led on prescription drugs. She's led on intelligence. She has led on opposing the escalating war in Iraq. Anyway, I just can't say enough about you. Now,
but let's move on. Let's move on.
We will move on. But before we move on, people might ask, why would Republicans do this? Why do they want to repeal the Affordable Care Act? News broke right before we got here that Tom Cotton told us that if they have the House, the Senate, and the White House, they want a reconciliation bill that makes permanent the Trump tax cuts for the wealthy. And you know how they're going to fund it in part? By repealing the Affordable Care Act. So with that, I want to introduce my partner in crime. I want to introduce the person that is the heart, the soul, the brains, the money, everything about Protect Our Care, who had the foresight to get together with Speaker Pelosi and all of our Democratic members and other groups to organize. You know, a lot of people didn't think it was possible. They said, well, Donald Trump's president, they're going to repeal the Affordable Care Act. And Leslie Dock, the most relentless political operative I've ever met, said no, hell no. And he organized Protect Our Care, and organized the coalition, organized the 10,000 events that saved the Affordable Care Act. And we didn't stop. We kept going. We made it the issue of 2018, and then we turned around and we have expanded, enhanced the Affordable Care Act, and done what we've done on prescription drugs to the IRA. So with that, let me turn it over to Leslie Dock, Chair, Founder, Protect Our Care.
Thank you, Brad, and thank you for everything you've done throughout your career to make America a better country. And thanks, of course, to the Speaker, because there would be no Affordable Care Act, there would be no IRA if it wasn't for her leadership. Healthcare is on the ballot. Your healthcare is on the ballot. Republicans want to take it all away. Healthcare is also on the ballot because it can win this election for us. And one thing about healthcare is that it is the kitchen table issue of America. We all know that when one of us gets sick, it dominates our lives. When someone in our family gets sick, it dominates our lives. And when you're sick and you can't afford the care you need, you can't afford your insulin, you skip your doses, you can't afford to go to the doctor. It is an amazing trauma for American families. The Affordable Care Act and the lower cost drug provisions of the IRA have finally given America a safe place to land so that they know they can get the health care they need. But we all know that it's now at risk from the Republican Party. And who wakes up in the morning thinking that what America wants is to take away their health care? Well, apparently the former president and J.D. Vance do. And we all know, as people said, that J.D. Vance and the former president are serial liars. But it's interesting that they had to reserve the biggest whopper of all, that J.D. Vance had to reserve the biggest whopper of all when it came to healthcare, because he knew how untenable and their position was. And he couldn't tell the truth, so he invented this story. Let's be clear, there is no greater threat to American healthcare than Donald Trump. Let me now turn to introducing our next guest. You know, the speaker has taught us a lot. One of the things she's taught us is the power of the grassroots, the power of storytellers to shape a political debate, to motivate people to vote, and to make it understood why this is so important. Telling stories is a powerful tool. And so with us today, we have perhaps the most powerful healthcare storyteller that I have ever met, not only because of the power of her own story, but because of the work she did to pull together little lobbyists, to start that organization, to make all the visits that she did along with her other colleagues to take this issue home to politicians and to communities around the country. Elena Hung is the founder of Little Lobbyists. She is the mother of a fantastic young lady, daughter, who was born with far too many very dangerous medical conditions, but is now thriving thanks to the Affordable Care Act. Elena made such a difference in 2017. She's never given up the fight, and it's an honor and a privilege to walk the halls of Congress with her when we all get a chance to do that. Elena, we look forward to hearing your remarks.
Thank you, Leslie. Wow. Hello, everyone. I am thrilled to be here with all of you. I'm here because of healthcare. I'm here because of my amazing daughter, Xiomara, who is the joy of my life. The reason, as you know, why I started Little Lobbyists, which advocates for children with complex medical needs and disabilities. And like Brad and Leslie said, we saw last night and the past few weeks what they're trying to do. We saw that they're trying to rewrite history with their lies. We saw what's his name, right? Trying to recreate history, but we know it's a lie. We know because we were there. Xiomara and I were there. You were all there. It was 2017. Xiomara was not quite yet 3 years old when we first showed up on Capitol Hill with families like ours. We were there to defend the ACA. We had to defend the ACA because the ACA saved our lives. And I tell you without exaggeration that Xiomara and children with complex medical needs and disabilities are alive today because of the ACA, because of Medicaid. You know, I think about babies like Xiomara, who's 5 months in the neonatal intensive care unit, total $3 million in medical costs. But they are alive today and have a chance at childhood because the ACA banned lifetime limits on their care. And kids like Xiomara, who was born with pre-existing conditions, and then she later added more pre-existing conditions. She's an overachiever like that. These kids are getting the care they need because thanks to the ACA, insurance companies can no longer discriminate against people with pre-existing conditions. And now, I've often said, there's not a single thing I would change about my daughter, but there are a million things I would change about this world so that it would be worthy of her. And the first thing I would change is that everyone would be guaranteed affordable, quality healthcare, because healthcare is a right, not a privilege. Now, I want to share with you that Xiomara celebrated her 10th birthday this summer. 10th, double-digit club. And she has been able to thrive and thrive because of the care that she has received, because of the care that my family has been able to receive. So this is personal, and my story may not be your story, and your story may not be mine, but we all have a healthcare story. We all have a healthcare story, all of us. We all have loved ones that we care about. We all want to be cared for when it is our time. And the ACA protects us from being denied healthcare. And let's not forget, there was a time when that was not the case. There was a time when insurance companies could discriminate as they wished. They could deny care to disabled people or charge more just because we are women. And now, as Kamala Harris says, we are not going back. Friends, I invite you to share your healthcare story like I have, like so many have, to put a face on healthcare. Remind our country that we are better off with the ACA. Fight back like our lives depend on it, because it does. And I know that we can do this. I know because we have done it before. We saved the ACA in 2017, and we can do it again with this election. And and like our future Madam President said, we can all do it with joy, because we are not just fighting to survive, we are fighting to thrive. That's why we're here tonight, to thrive, to see our children thrive. So let's do this. Let's do this, everyone. Thank you for sharing your time with us tonight. Thank you to Protect Our Care for leading this fight. We can't do this without you. And last but not least, thank you, Speaker Pelosi, always and forever. Love you all. Thank you.
Elena, thank you. I mean, I remember, and I know Leslie does, and I know the speaker and Ann and everybody on this call remembers the countless press conferences, media avails, the protests on the lawn in front of the Capitol. You were there. You are there. Your family's there. Your story is there. It is so vitally important. And I think the most unfortunate thing about tonight is that we're having to do this again. And but thank God we are all still here and still in the fight. And like you said, we're not going back. With that, I want to move on to another story. Reggie Hubbard is the Save Our Healthcare campaign director for Team Pelosi. But Reggie is not just an advocate. He's not just an activist. He's not just an advisor and a strategist. He is someone who has his own and recent healthcare story and can talk about how important coverage and the Affordable Care Act is. So with that, Reggie,
Brad, thank you. Can y'all hear me? We good? Cool. What a great honor to be with you all this evening, dear friends in the movement to protect and expand the Affordable Care Act. Dear fellow fighters for freedom, justice, and equality, and against tyranny, injustice, and cruelty. On this day, 2 days before my 50th birthday, I turned 50 on Saturday, hooray, hooray. And 1 day after the 6-month mark of perhaps the most significant moment in my adult life, in my spiritual life, in my advocacy thus far, because on April 1st, fresh off the celebration of the ACA anniversary and our National Day of Action that we inspired, at about 4:30 in a hotel room just outside of Columbia, South Carolina, I became a member of the Stroke Survivor Club, a club that my family history told me that I'd probably be a part of and I'd potentially be a member of, but I never thought I'd be so intimate with my neurology or the healthcare system. Just really didn't see it. On that early morning, I didn't just have a stroke. I became a patient. I was miles away from home. I was out of network and I was at the mercy of our healthcare system because given my condition, I was just along for the ride. In that moment, I went from activist and advocate to patient with now a pre-existing condition. I shifted from being an advocate fighting for healthcare because it was the right thing to do to an acute awareness of healthcare and continuity of care and quality of care are critical not only to your diagnosis, but to your recovery. After stabilizing, I woke up in critical care of the Lexington Hospital Center, and I lost all motor function in my left foot. And below my knee, my leg just wasn't working. I had a neurological impairment with my left leg. And I didn't know if I was going to be able to walk again, y'all. I didn't know if I was going to be able to teach again. And perhaps most terrifying to me, I didn't know if I was going to be independently mobile and able to be out there and stir up good trouble. Like I didn't know if I was going to be able to be in the fight. But guess what, y'all? 4 things saved me. They were my faith, my meditation practice, my community that prayed for me, and the Affordable Care Act. I spent a week in critical care, and I miraculously made it from South Carolina to inpatient rehab in Washington, D.C. That's another story for another time. Let's just say miracles happen. Thank God for angels. And I met with doctors and case managers and health plan employees and nurses day and night. I had a crash course in acute care. I got a PhD in the bill. Like I went from like knowing it theoretically to knowing it actually. And stroke is one of those things that is usually only mentioned in those pharmaceutical commercials that includes the word death. You know, it's like stroke and blah, 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 and death. Like, so stroke isn't really celebrated, have any, you know, and stroke recovery is one of the most challenging experiences, not just for stroke survivors, but our caregivers. Because a stroke can be so disruptive, not only to the life of the patient, but our friends and family also. The Affordable Care Act changed immediately from a policy that I passionately advocated for and sought to organize around to a vital lifeline that not only gave me access to the system, but a path to navigate my stroke incident, my recovery, and the aftermath of the event. You know, as an entrepreneur and independent contractor, the only place I had access to healthcare was the Maryland Exchange. And the plan I chose on the Maryland Exchange has been a good faith partner in my recovery. They even cover acupuncture. So acupuncture, since I had a stroke, I was like, I need to take care of my nerves, right? So they covered acupuncture as part of my recovery with a $10 copay. What? Like ridiculous stuff like that. And I know intimately the plight of someone who would look at their medical bills and have your eyes closed because you didn't know how many zeros were going to be in the number. You know, will this number be something that I can't read because I was a philosophy major? You know, is the final bill coming? Like, will there be another shoe to drop? And like I said, my plan covered hospitalization, emergency room, critical care, inpatient rehab, acupuncture, medications, orthotics. I've had to learn how to walk again, y'all. So orthotics and walkers and the thing were all covered by my plan. And as we all know, there's some in our country who are addicted to cruelty and chaos because as a person of faith and an activist and a spiritual teacher, I just don't understand them. Like, how is it even possible after a pandemic and after record engagement with the ACA that you threaten to take it away? I just don't understand that. And there, those who call us who seek to care for the sick, communist. It's not communist. It's common sense. It's for our common good. And in terms of our values, it demonstrates that there should be the guiding force of any public servant, compassion. So not communist, common sense, common good, and compassion. So like it has been said in the history of this country, it's up to us to take care of us. And that's what I tell everyone about my stroke recovery and the Affordable Care Act, is it didn't just save my life, it protected me from financial ruin when the unthinkable became my norm. Like I didn't go to bed on April 1st thinking I'd have to learn how to walk again, right? But we know that healthcare is a right, not a privilege. We know that extreme Republicans at the top of the ticket all the way down have the Affordable Care Act in their sights to eliminate, and that their concept of a plan is to repeal and leave hundreds of millions of us in the wind. We know that telling our stories to one another again and again, reminding our neighbors of kitchen table issues that matter most, and keeping our focus on the clear contrast in our vision and values, that we can and will be successful. So in the remaining time that we have ahead of the election cycle, may we be clear-eyed, open-hearted, and relentless in doing what we can to take back the House, keep the Senate, and elect Vice President Harris and Governor Walz, because we saw last night they get it. Like Governor Walz, I was just like, can we clip this and send it to everybody? He's totally talking about it. They will prioritize and create opportunities for all of us and protect and expand our healthcare. It is a delight to be back in the fight with each of you. I'm rested and I have a deep perspective, not only of the ACA from the perspective of my values, but also from seeing the legislation as being a critical aspect to my recovery journey. Thank you, Speaker Emerita, Brad, Leslie, Elena, each of you for your great work now and until now and going forward. Peace and blessing and love.
Reggie, you're an inspiration. You're an inspiration. I mean, your story is an inspiration. Your recovery is an inspiration, and it is. I don't know when or if or ever that Republicans, that a J.D. Vance or a Donald Trump or a Mike Johnson or previously a Speaker Ryan, or how they could hear a story like yours or a story like Elena's and her family, or the thousands of stories that we've heard over the years, and say, nah, you're on your own. You're on your own. Nah, we need that money for another tax cut. We need that money so CEO can buy another yacht. We need that money so somebody can buy a $100,000 watch that Donald Trump is hawking online. And I don't understand it. I don't think they're listening to the stories. I think they're, even if they were on this call, I think their ears are closed, their minds are closed. But thankfully, we've got the American people with us, and it's because of people like you. It's because of people like you. With that, we have one more speaker, very important speaker, and this is what I hope everyone. One of the things I hope everyone hung on for tonight, which is a few quick points about how healthcare is received by the American people in terms of what we've seen in the public opinion polls, how the Republican approach to healthcare is received, and what we need to say. What we need to say, probably the most important thing we can say are these stories. The storytelling is the most important, but we also got to have persuasive language, and we've tested and tested and tested, because that's just what you have to do in these campaigns. And so I want to turn over to Ann Schaub. Ann Schaub is the communications director for Protect Our Care, but Ann Schaub to me is a lot more than the communications director for Protect Our Care. Ann and I go back at least 2014 in these fights, in the political fights, healthcare fights, advocacy fights. She is a true healthcare champion. She is a star of stage and screen in terms of explainer videos that she's done over the years to inform the American people about what's at stake. And with that, shout, let it all out.
I wondered if I would get the Tears for Fears intro, but now you all know how to say my name. Okay, hang with me, everybody. It's just such an honor, first of all, to be here with Speaker Emerita Pelosi and our wonderful panel. And I am just going to pull up a presentation here, but I promise. I just think it's really, really important that we get through a few points. And so, because you are all fired up from our amazing speakers, and so now what are you gonna say? So we're just gonna go over that quickly and wrap up. But I know that we want to be saying the right things here, and so I'm going to go through two quick slides, but really I'm going to go through them because just to make a quick point. Now, we put out this poll over the summer. We've worked over the years with Heart Research, and as Brad said, just doing message testing over the years. So just know that everything we talk about here has been message tested, and we're really trying to figure out the best ways to say things that resonate with voters the most. So why are we talking about healthcare other than the fact that everybody watching online, watching the live stream is extremely passionate about it, and are all fired up right now to talk about it? we're talking about healthcare because it's actually a winning issue for Democrats. So that's what I'm trying to say here with this slide. If you look at it here, you can see that, this is specifically about the ACA, but the Democrats' approach versus the Republicans is the Democrats are extremely popular. If you take a gander over at the battleground states, extremely popular there. Among independents, extremely popular there. So that is making the case. Why are we talking about healthcare now? At this critical moment, we're talking about this critical issue. And then on the flip side of that, we have the Republicans have huge vulnerabilities on this issue of healthcare. This particular slide is about drug pricing policies that are in the Inflation Reduction Act. So you can see Medicare negotiating lower drug prices, capping insulin costs, capping how much seniors pay out of pocket. If for voters, if they know that a candidate is not supporting that, as the Republicans are threatening to repeal the Inflation Reduction Act, they're much less likely to support that candidate. So this is also a tough issue for Republicans. Now, so what do we say? Now, the thing that our other speakers have said beautifully is that healthcare is just such a personal issue. And unfortunately, a lot of people are still struggling with affording their care. They're struggling with navigating a complex system. Reggie just talked about really well. So, we want to acknowledge that and meet them where we are, but we can still talk about the wins that we have. And that's really important. So we have come a long way and we're not going back. I wonder if you've heard that before, but we can totally celebrate how President Biden, Vice President Harris, and Democrats in Congress, they took on big drug companies with the Inflation Reduction Act and they won. That is massive. We reduced premiums for middle-class families. We got Medicare the power to negotiate. And not only that, they have proposals to expand on that success and to expand it to everyone. So, while we have the one side who is working to give us lower healthcare and better healthcare, we have the flip side of that. Republicans want to undo all of this progress, and that will hike costs for people. So that is what is at stake here. We really have to get into what is at stake. So these are just some of the things that would be taken away if Republicans had their way. And of course, they want to repeal the ACA and the Inflation Reduction Act. We talked about that, / Medicare and Medicaid. But I think a really important thing to remember is that we've fought, this crew has fought and saved the ACA, fought to pass the ACA, fought to save the ACA so many times. So we really understand what's at stake, but the ACA is really woven into the fabric of society now, right? So people may not understand what repealing the ACA would mean. So we really have to make the stakes clear. We cannot go back to a time when drug and insurance companies were in charge. We cannot let them have full reign. In fact, we need to be going the opposite direction. So, that is just something that the stakes that we have to really talk about. And a great way to do that is talking about ripping away the protections for the 100 million plus Americans with pre-existing conditions. We've talked about that a lot already, but the truth is that everybody on this call, on watching this on YouTube or Facebook, everybody either has a pre-existing condition themselves or someone they love has a pre-existing condition. One of their neighbors, someone in their family. So making the stakes of that really clear, understanding that it would really, make it so they might not be able to get insurance if the Republicans have their way, that they wouldn't be able to get the life-saving care they need. And, that would be hard for someone like me, that I have very treatable asthma, but, really understanding how the stakes of that could grow for other people with more complex medical needs, explaining that to them, telling these stories is so important. And then, of course, we're talking about the ACA, the Inflation Reduction Act, slashing Medicare and Medicaid. But we also have our fight on the reproductive care side, and of course, that is a threat to healthcare as well. So it feeds all in to this narrative that our healthcare is at stake. It's under threat. And then, so this has already been touched on before, but just to nail the point home, like, look, we have been mocking concepts of a plan a lot, and rightfully so. That was an absolutely ridiculous statement. J.D. Vance's statements yesterday during the debate, absolutely ridiculous. But and so rightfully we mock them, but remember that they have a plan. We saw them try to put it in action. It's the people on this call that saved it, along with all of you in the audience, that saved us from having their plan go into effect. So they already tried and failed to repeal the Affordable Care Act, and they are actively threatening to do it again. So, you know, anytime that they try to walk back that really unpopular position, because, you know, you saw the first slide that I showed you, it's a very unpopular position. Anytime they walk that back, we have to call them out on that. No, we know your plan, whether it's from what you tried to do before, Project 2025, we know what you will do. And then finally on this slide, you know, we have just a handful of things that you know, poll very well of, like, you know, these items that would be taken away really resonate with people. But it's really been drilled home, but I just want to say it one more time that such an important way to get that at this is really storytelling. So when you're out there and you're talking to people, because you know what, we have such an amazing network out there. You all are so powerful. If you just go out and tell this to people in your community, tell this healthcare story, you know, that would think of that about the impact that would have in these next few weeks. So, you know, depending on who you're talking to, it might be a young person who would be impacted if they were going off their parents' plan. It might be someone with a pre-existing condition. It might be someone who's covered on the Affordable Care Act exchanges now, and, you know, might get some help thanks to the Inflation Reduction Act to purchase their coverage. You know, like these are some of the issues that that might resonate with them, but also tell the stories, tell your story, you know, highlight other storytellers. It's an amazing way to get out there because, like we said, this is a deeply personal issue, and it really helps people understand it and drive the message home. So, you know, with that, I want you all to take this message out and do what you can in the next couple of weeks, as I know you all will. And thanks so much for being here tonight. And I will turn it back over to Brad.
Great, Anne, thank you. I want to thank you so much. I want to thank all of our panelists. I really think that lay down there at the end, how important this is, how this ranks, what the popularity of these issues are, what is that threat, how to talk about what is it threat, and of course to do it in the context of the stories that we've heard and all the stories that we know are out there from people like Reggie, from people like Elena and her family. And so I want to thank Elena. I want to thank Reggie. I want to thank Anne. I want to thank Leslie. I want to thank Speaker Emerita Nancy Pelosi, who has, I know that she has gotten off the call because I'm sure she's either raising money or turning out the vote or doing some type of media to help us win this election. But it's so tremendously important, her legacy to this. And of course, it's not done. I mean, if we have the majority in Congress next year, it will be part because Nancy Pelosi will be there, and she'll help lead the fight. I do want to mention one other person from Protect Our Care, whose name I shouted out earlier, but I want to mention Adam Hoyer. Adam Hoyer helped pull this call together. Adam Hoyer is our partnerships director. He helps run our state teams, and he is a storyteller himself. He has his own. I'm not going to do his story. He can do it himself one day on one of these calls. But he has his own healthcare story, and he's a passionate advocate for this work. And frankly, he is the one that worked so hard to put this call together, to get Speaker Emerita scheduled to do this call. So I just want to thank Adam. With that, I'm gonna close this call. I want to thank everybody. We have 30. I don't know, somebody correct me. I think 34 days left, 35 days from the day after the election that we're celebrating. We hope an important victory. But here's what I will say: healthcare is on the ballot. It's why you're here. It's why we're here. It's what we're going to be talking about for the next 34 days. The Affordable Care Act is more popular than it's ever been. We have 90% support for Medicare drug negotiation. Their positions on healthcare are among the most unpopular positions that a politician in America can take, and we're going to make them pay a price for it over the next 34 days. We're going to talk about our accomplishments, talk about our agenda for the future, and come this time next year, we're going to have more healthcare wins because of the work we do over the next 34 days. So with that, thanks everybody. Let's go win. Have a great night.